If you suffer from vertigo or dizziness, today I'm going to show you 2 acupressure points that's going to get you instant relief. I'm Dr. Matthew Posa, and I'm a chiropractor in Milton, Ontario, Canada. I help people get over their health challenges so they can live the life they were designed to live. If you want more content about health tips and tricks, then subscribe to my page and don't forget to click on the notification bell so every week when I release a new video, you'll be the first to know. And don't forget to share this information with the people you know need it the most. If you're suffering with vertigo or dizziness, it's an unsettling feeling. It can make you even sick to your stomach. It obviously affects you from day to day. Some people it affects their sleep. It could affect driving. It could affect walking, communicating with people. It is really horrible. So today I want to show you what I would recommend to patients so that way they get instant relief, they can feel better, and they can get their life back on track. But at the end of the video, I'm going to leave you with an extra bonus tip for especially for the people who have vertigo or dizziness, but that they're noticing it's affecting their ears. What is acupressure? So acupressure is quite simply pressure points on the body that are based on traditional Chinese medicine that has helped people for thousands of years, and all we're doing is showing you how to use it at home. So there's a couple key areas of your spine that causes a lot of this, the vertigo or the dizziness. And the number one area of your spine is going to be the top 2 bones in the top of your skull. And as a chiropractor, that's the area we would analyze, we would check, and that's the area we would adjust. However, you're at home right now, and if you don't have a chiropractor, then this is what you can do. So the first one I want you to do is I want you to locate the one that's underneath your earlobe. So if you have your earlobe, you'll notice that there's an indent right behind, and there's actually the tip of your first cervical bone, and that is your atlas. So this is the tip of your atlas. So if you push on it, you're going to notice that you either feel the bone, you'll actually feel that underneath, or it might be even super tender. Now, the side that you would normally get vertigo or dizziness. So for some of you, if you turn your head to the right, you'll get that dizziness. Well, this is the one I want you to start with. But for other people, it'll be turning your head to the left. So first, let's start with locate the side that you get the most dizziness or vertigo from. So if you're turning to the right, it would be your right side. And then what I'm going to get you to do with your index finger is you're going to put pressure right on the side. So right on the side of the bone. And what you're going to do is you're going to rub it in a circular motion. And I always want you to go clockwise. So we're always going in a clockwise direction or towards your face. We'll start with going towards your face and then down, towards your face and down. So you're just doing this, and you're going to do this for about 20 seconds. And then what you're going to do is you're going to create balance. So we want to go to the other side. We're going to do the same thing. And again, now this one, when you're on the left side, is again clockwise. So left side would be the opposite way. So it would be going towards the back of your head first and then going forward. So it's not towards your face. So it would be backwards this way. Now, what you're doing is you're rubbing these points. And because you're doing this for about 20 seconds, you're stimulating the nerves, you're stimulating meridians, which is the traditional Chinese aspect of this. But really what you're doing is you're stimulating the nervous system in order to have an effect. And the effect that we're looking for is a calming effect, a calming of the nervous system. Because in these cases, in most cases, no matter what the cause of the vertigo is we're getting a hypersensitivity of the nervous system. The nervous system is on edge and not much can throw it off, including too much stimulation. And that's why when you're turning your head to the left and right, you're getting the effect. So you're going to rub that for 20 seconds. Now, here's the thing. You can do that 7, 8, 10 times a day. The only thing is I would suggest is only do this every 2 hours. I wouldn't keep doing it constantly throughout the day because then you're overstimulating your nervous system. And again, we're trying to calm it down. So I just want you to do this every couple hours. Give your body some rest and then repeat. Now, if you notice that if you're pushing on here and you're getting an instant relief, well, then that is also most likely the bone that we're talking about. We're talking about the atlas bone, which is the top bone, and that bone is probably, and I say probably because we'd have to check, but it's shifted. Now, the other area that I want you to look at is below the skull. So I'll turn around here. You're going to see the back of my head. So what I want you to do is there's these muscles right here. So what you're going to do is you're going to take your fingers. I just want you to run it at the base of your skull. You're going to feel the bone. You're just rubbing it, and there's this indent in through here. Now, as you run your fingers, I want you to feel if there's a muscle that is in particularly sore. What most of you are going to find is one of the muscles is going to stick out. Now, typically what I notice with a lot of my vertigo or dizziness patients is that they have it more towards the outside. So a little bit less in the middle and more to the outside. So what you want to do is you want to bring your finger into here. You're going to find the part that hurts the most. You're going to notice it's pretty sore. And again, and then you're just going to rub it. Now repeat the same thing on the other side. So don't just stick to the one side that, let's say, hurts. Let's say it's the right side. I want you to do both sides. You're rubbing them. And when you rub these, you're doing a circular motion. Now in this case, I'm bringing my fingers inwards and then out. So it's in, up and in, and down and out. So it's that motion this way. So we're going towards the middle and then bringing it out. But what I like to do is as I bring it back up, and I'm lifting up a little bit and coming down, lifting up a bit, and then you can start moving your head with that just to get really deep in there. Again, you want to rub this for about 30 seconds and get that instant relief. Now, those are called the suboccipital muscles, and so this is an acupressure point, but it's also a really good spot to just decompress. Now, the people who have vertigo or dizziness associated with neck pain, or you get headaches, that's going to be a really good spot. You're going to notice a lot of relief with that one. Now, the bonus one I want to show you today has to do with, again, the people that have vertigo or dizziness, but you notice that there's a fullness in the ear. You're either getting tinnitus or tinnitus, which is that high pitch kind of sound in your ear that doesn't necessarily go away. In fact, when there's not enough noise, that's when you're going to notice it the most. So in this case, what you want to do is you want to go to your ear. So let's go to the ear that's going to be the most affected. And so it'll be the side of the headache. It'll be the side of the high-pitched noise. But typically, it'll also be a little bit sore. So an acupressure point is going to be just to the front. So you have this little piece here. And just in front of that, it's where the mandible is. So if I move my jaw, I'm going to feel it pop just a little bit. So that's how you know you're on the right area, and it's going to be pretty tender. And mine on the right is actually pretty tender. So we're going to do this right now. So what I'm going to do is I'm going to hold this, and I'm going to keep holding this, and it's just straight pressure. And we're going to do this again for about 20 to 30 seconds with this one, because we're not rubbing it. So we're just holding. And we're just going to let that settle. And then the last part of that is you're going to grab with your two fingers like this. You're going to grab the base of your ear. You're going to pull down. You're going to hold in that. You're going to feel it. Now, some people are going to feel your ears drain with this. So this is quite good, especially if you have chronic ear infections, things like that. But what you're going to do, or a blockage in the ear, but what you're going to do is you're going to pull down on your ear. So I'm pulling down. And then the next stage, you'll turn a bit to the side so you can see it. The next stage is as I pull down, I'm going to hold this for about 5 seconds, and then it's a quick back. That's it. So don't hold it. So it's going to be down for 5 seconds. Just open up that space, and then a quick pop. And that's it. And if you do that, you'll actually get some other relief too. It's a pretty cool technique. It's something that I can do to patients here in the office, but it's a home technique that you can try that can actually alleviate some other symptoms as well. So go ahead, give that a try. I want to know how you're doing. If you have a comment or a question about this video or about vertigo or dizziness or any of my other videos, you can leave it down below. And if you need more help with vertigo or dizziness, I go through the top foods you need to avoid, and also another video on some stretches or some exercises you should try in order to help your dizziness or vertigo.